Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Thursday, April 16th, and this is my daily briefing. The number of cases as of right now are the same as they were yesterday. We've had a total of 35 cases to date in Missoula County. 33 of those cases were identified through lab testing, and 2 were epi-linked. We have 24 cases that have now recovered and 1 death, leaving 10 active cases. We're currently monitoring 168 close contacts who are in quarantine at this time. The state of Montana has had a total of 415 cases and 7 deaths. I have a few different topics that I want to talk about today. One of them is our local health officer orders expiring. So the local orders did expire this week. However, the governor's directives were extended through the 24th of April. These directives and closures are more stringent than the local health officer's orders, so the fact that the local orders expired doesn't change anything. Non-essential businesses must still remain closed. Essential businesses must provide social distancing measures when possible, and restaurants and bars are still limited to takeout and delivery. Another topic that I just want to touch on today is that we've been asked to disclose the number of cases of COVID-19 in youth homes, detention centers, group homes, nursing homes, and state prison and the state hospital on a daily basis. First, the state prison and state hospital are not part of our Missoula County jurisdiction, so we would not have those numbers to report. Second, as we've said in previous updates, we will not disclose where a case lives or works, and if the organization affected decides that they want to do so, they can release that information, but we cannot release any information that could lead to the identification of a case. If you're concerned that these facilities are hiding outbreaks and cases, that is extremely unlikely. If they get a case, the test results have to get reported to us and the state health department. Again, what we will report is a cumulative number of cases, both lab confirmed and epi-linked, as well as the number of recoveries and the number of fatalities. And I also just want to add that we are in very close contact with our homeless shelters, our group homes, the detention facility, any kind of congregate housing. So we are helping them with guidance on preventative measures and what they need to report to us and when. So the other topic that we want to talk about is what does a stay-at-home directive mean for essential workers? As you may have noticed on our Facebook page, our team at the health department started a hashtag Stay Home Missoula campaign to encourage social distancing, support essential workers, and encourage people to follow that governor's directive of staying at home. For those of you who are able to work from home, this message resonates with you and is relatively clear. For those essential workers who make our food, deliver our packages, care for our infirm, repair our roads, stock our shelves, and so much more, we understand that you must leave home to go to work. However, if you are an essential worker, you are still upholding the stay-at-home directive when you practice social distancing while at work and then head home at the end of the workday. You're protecting the community when you leave your home only for essential work or for activities like grocery shopping or medical visits. So if you are an essential worker, we just want to thank you for everything that you are doing to keep us fed, connected, and cared for, and thank you for staying home when you can. So the last thing that I want to talk about today is why COVID is a big deal in Montana. We're a predominantly rural state, and when we're looking at that relative to other more populated states, the number of cases in Montana and Missoula seem pretty low. However, it's important that we think about the impact that a case can have in Montana. Some of our counties are sparsely populated, which means a handful of cases can represent a lot of disease for the size of that population. And just because we have big rural expanses doesn't mean that there aren't community centers where COVID-19 spread can happen. Right now, when adjusted for population, let me start that over. When we adjust for the population, we have similar rates of disease to some of our more impacted states in the United States. Even more concerning is that some of these rural counties may not have the healthcare infrastructure that's available in urban counties like what we have here in Missoula, and that could lead to poor health outcomes, especially if the number of cases increase. So this challenge with COVID-19 is not just a question of how to control the spread in urban areas. It's an anywhere problem. And once it takes root in a smaller jurisdiction, the impacts can be really large. These concerns with rural counties can also start impacting urban counties. Of course, the more populated a county is, the more potential that they have for spread, especially if social distancing measures are not followed. However, something to keep in mind is that urban counties are not populated islands. There are people who travel into them from smaller surrounding counties for work or for shopping or for medical care. People traveling county to county can either bring illness in with them or take it back to their own communities. What this means is that urban and rural counties are interconnected in how this disease can spread. This is why you can't treat only one county in isolation. Additionally, the support networks that are needed to fight COVID-19 is much larger than just one county. When people in smaller jurisdictions get sick, they may seek care in urban areas, so the impact in one section of the state can be felt all over. So now for the take-homes. We cannot say that since our number of cases are low that this isn't affecting Montana, nor can we compare the total number of cases we have here to another location without adjusting for population. There are areas that have been hard hit in this state, and we do have the potential for things to get worse. One thing that I just want to include in that thought is that our testing in Missoula has been pretty limited to only people who are in those high-risk categories or work in a high-risk setting, and we were just able to open up that testing starting on Tuesday. So there are probably cases in our county that we just don't know about yet that are going to be found now that we're allowed to test anyone who is having symptoms. So additionally, we know that by looking at the states around us that we have not done preventative measures, that the preventative measures are helping. South Dakota has not issued a stay-at-home directive or an order for social distancing, and they have almost 3 times the number of cases that we do, twice the number of cases per 100,000 people, and a cluster of cases near equal to the total number of cases in our state. And now one of the state's largest employers is closed indefinitely because they don't have a healthy workforce. North Dakota is seeing a rise in cases, with almost 42% of them coming from community spread compared to the 26% community spread in Montana. We've looked at trend lines showing cases over time by state, and while Montana is still seeing new cases, the trend line is fairly flat. When you look at states without a stay-at-home order or supportive measures for social distancing in their states, the trend lines are going up, and some are going up extremely sharply. So what this means, it means that we've all taken steps to minimize the impact to both our urban and rural communities to protect our healthcare resources and really take care of each other. So it is important that we continue to do those social distancing measures and stay at home in order to protect our communities. And that's all that I have for my daily briefing today. I again want to just say thank you for everything that you are doing out there to help protect our communities. You can subscribe to me on YouTube under my name, Cindy Farr, CINDYFARR. You can follow us on Facebook with Missoula City County Health Department. Check out our website at missoula.co/cvirus. And you can call 258-INFO if you are having symptoms of COVID-19 and you would like to schedule a test through our drive-through testing facility, or if you have any general questions about COVID-19 in general, or accessing resources such as rental assistance or food, that you can find out all of that information at that one number, 406-258-INFO. So everybody stay healthy out there, and I'll talk to you again tomorrow.